Thank you for tuning in to another episode of Disrupt HealthTech. I am your host, Wendy Austin, and today we're going to talk about a new way to see the doctor. Let me introduce our guest, Samantha Sharon, who serves as the Chief Operations Officer for Ascend Medical. Samantha Sharon joined Ascend Medical in June of 2020 and has 30 years in the healthcare field. Samantha has multiple unit operational experience, training, and development. Her most recent role was the Chief Compliance Officer for a DSO that operates in 16 states. Samantha also owns SCS Consulting, which supports companies with operations, training, and compliance within the dental field, men's health, pain management, and vision. Welcome, Samantha, to Disrupt Health Tech. I'm so happy you're here today to talk about Ascend Medical and how you're changing the traditional doctor visit.
Good morning. It's a pleasure to be here. Thank you, Wendy.
Thank you. Let's start with a quick discussion of what Ascend Medical does.
Absolutely. Would you just like a quick overview?
Yeah, if you could, just
Sure. Absolutely. So we are what we like to call a full primary care, pediatric, and behavioral health platform. We're available in both telemedicine and to the home. So we service 0 through the end of life is how we like to present it, and we take care of the whole entire patient. So 0 to the end of the life, being able to take care of them from pediatrics, primary care, and then the behavioral health space.
Yeah, that's great. So Ascend Medical is not just your ordinary telehealth company, though, right? So you actually offer house calls. Can you expand upon your decision to offer house calls as well as telehealth calls? And maybe explain how Ascend Medical is different from other telehealth companies.
Sure. So I think it's starting, when we started in June of 2020, we really started with the premise that we were going to acquire primary care practices. When COVID, we were in the throes of COVID, we quickly had to pivot. So we all got on a call, we were brainstorming, we said, telemedicine, this is really the way to go. As we started looking at that, if we were truly going to be a primary care provider, you can't just stop in a virtual world. You have to be able to continue to care for that patient hands-on, make sure their labs are being done. If they have any urgent care needs, if they're sick, how do you get to that patient when you're sitting behind a screen? And so, we just thought, okay, let's really kind of dive into this and understand what our capabilities are to bring the services to the patients. And that's how we ended up with the initial platform of Ascend. The toughest part was we were in COVID. And so people weren't looking for primary care services in COVID.
Yeah.
And so you go, okay, how do we change this so that we can be available to patients who need it? And then it quickly turned into, okay, we are really going to get our foot in the door with people looking for COVID testing, COVID visits, events on site, helping schools get back to school, helping businesses get back up and running, manufacturing. So we went into the COVID testing, delivery in the home, and then into office space.
Okay.
And then when the vaccines came about, we really knew that we were a delivery model that could come to the patient, because there was such a fear for many patients of going back out into offices and things like that.
Yeah. Oh, very good. Very nice. It just proves that out of disruption of life or those types of big events, that's when innovation happens.
Exactly. Yes, true. I would say the toughest part was really trying to come out of that COVID world on the back end. We knew it was coming and we had prepared ourselves for it. But then you have to completely change your business model, your business mindset, the way the doctors are treating, and focus on the primary care, the pediatrics, and the behavioral health. So that's really been the last year, I would say year and a half, of what we've been driving towards. And it's been very well received and welcomed. So we're excited about the path that it's taking.
Oh, very good. Very good. So you previously mentioned to me that the providers at Ascend Medical can also be considered a PCP or primary care physician by the insurance companies. How does this work if you don't have a physical location for patients to go to? And would you be considered a medical group by these insurance companies?
Yes. So I'll take Georgia, for instance. Georgia's law, basically, the outline is to establish care for a primary care provider. You have to have a hands-on physical one time per year.
Okay.
So this is really, I think, very innovative in the way that, hey, we absolutely have to, if you're establishing care with us, we have to do a home physical for you. We have a care team that goes out and does that baseline home physical under the direction and supervision of the primary care provider, the physician. They do, and this is where I think we're very much set apart from other telemedicine companies. Our doctors have a full half hour with that patient via telemedicine, and they go deep into their medical history. We try and get records prior to, so that we can actually look at, what may be missing. This gives our doctors a chance to practice in a way that they've never been able to practice in years.
Yeah.
Because it's like, it's like you and I talking. It becomes very intimate at that point. People will tell you things over video that they wouldn't necessarily tell you in an office setting, and or they don't have the time because the provider is, and we've all been there, we're sitting out in the waiting room, we're there for 40 minutes, we're getting frustrated. Right. They take us into an op room, we're sitting there for another 40 minutes, we hear the doctor going in between rooms.
Yeah.
We're getting frustrated because we can hear it. And at that point, it's like, I just want out. Like, come in, give me my care, I want out. And the doctor is thinking exactly the same way. I'm going to pop in. I'm going to do what I have to do. I'm going to see them for what they're here for. I'm not going to ask any other questions because I've got 3 other patients waiting for me in other rooms.
Yeah.
So when you say disruption, it's disruption on so many levels. And it really allows the doctors to practice the way they thought they were going to practice when they were going to med school.
Yeah, like if I could just for a moment, there's so many things on social media from new doctors that are talking about what they thought, their care of patients would look like, and when they get into that traditional practice setting or medical setting, they're surprised where they're like, I only get 15 minutes with each patient. I only get to do certain things, and then like I'm off to the next thing and I'm rushing around and everything. So that's quite a different model when you're talking about, preparing ahead of time and then go visit the patient where they feel the most comfortable.
Yeah, it's been eye-opening and it's been tough really to, I think, get our consumers, and they really are consumers, and you have to look at patients like consumers because they have a choice. And when we started this, we said, what are the things that we can do different? And it's really customer service is huge for us. Yeah. And really getting engaged with our patients and understanding what their needs are, how we can fulfill them, and then always delivering, so always being accessible to those patients in a group setting. So, you ask the question, are you, remind me exactly how you phrased it.
Are you considered a medical group?
We are considered a medical group. I would call us a medical specialty group because there's so many different areas of care that we have under. So it allows us to, take, as I said earlier, take care of the entire patient.
Yeah.
But I would say that, we have a care team. So we have a doctor, an APP, and then medical assistants that surround that group. Our Whenever our patients go to schedule an appointment, they can schedule with either or. We don't tell them you have to see the APP. We don't tell them you have to see the provider. Whatever schedule is open, and whatever their needs are, and if they want to see the same provider every single time, we allow them to do that. We don't force
Okay.
them into a different provider group.
Okay. Yeah, that actually gets to my next question. So, talking about the providers, you just mentioned that if they want to see their provider all the time, they can. I think it's, if I can, based on what you're saying, as any other doctor's office, I can say I want an appointment with my doctor, and then I have to get the next available appointment. Or if I need to see somebody right away, I have the choice to choose a different provider to see me either in a telemedicine type of visit or at a house call.
Correct. So you always have that option, and we surround our patients with the care team approach. And then we also do, we have emergency appointments. So we tell
Okay.
our patients, if they're a member, they will get an appointment when they call in within the same day.
Okay.
And that's the beauty of having providers that really want to be providing care in this type of environment, and they're vested in their patients. So they know if their patient is calling that it must be an emergency and they need to
Yeah.
get them in, and so they're willing to go that extra mile and go those extra steps to make sure that patient is seen. And it may be during hours, it may be after hours. You'd be surprised at how dedicated providers become when they're allowed to practice how they
Yeah.
want
They
to
want to. Yeah.
practice. Yeah, yeah.
So can I also ask about the type of providers that you have in your organization, just in terms of like the specialties, subspecialties?
Sure. So we have physicians, MDs, we have pediatricians, we have nurse practitioners, we have physician's assistants, we have APPs who are nurse practitioners or PAs, my
Yeah.
apologies, that are focused on psych evaluations and psych med management, that work directly with our behavioral health therapists. We don't currently have any psychiatrists on staff, but we do work very closely with several psychiatry groups.
Yeah.
So if patients need med evaluations, things of that nature, that we're able to refer to them and refer back in-house.
Yeah. Yeah. Okay. Of course, you have one of my favorite doctors as your chief medical officer, Dr. Michael Smith. So I was very happy to learn that.
Yes, you can't beat Dr. Smith. He's
Yes.
phenomenal, and he has such a vast background, and we're very lucky to have him at Ascend.
Yes. Yes. Okay. So when I looked at your website, I was surprised to see urgent care listed as one of your services. It's not typical of a telehealth company just because of the remote access part of it. So I have many questions about how you're able to offer the urgent care services. Can you kind of dive into what urgent care looks like at Ascend, and if there's limitations to this type of a house call?
Absolutely. I think there are no matter what type of service you're providing, there may be times when you're better in hands of
Yeah.
in an office setting.
Yeah.
So we do what we can in the home. So we do point of care testing. We do labs. There's all of our tests, our CLIA wave tests. They're all on our van. So we can actually go to the home. You can have results within 15 minutes
Oh, very good.
for things like strep, RSV,
Yeah.
COVID, anything that you would routinely go into an urgent care office if you're sick and have done. The doctor can see you virtually, make the orders. The van is to your home. Most times, if we think that we're going to have a visit where somebody's complaining of, sore throat, they've had
Yeah.
strep, previously, or it's been an ongoing issue. What we'll do is we'll schedule the telemed visit and then the van visit 30 minutes after the telemed
Okay.
visit, so that we'll know right away and the doctor can
Yeah.
go ahead and get those meds ordered for them and get them on their
Okay. Very
way
good.
feeling better.
Interesting. So does that mean the van also is equipped with the medicine, or do they still need to go to the pharmacy afterwards to get a prescription filled?
So we are now looking into ways that we can provide the convenience of having the medication immediately
Wow.
for like our top 10 urgent care, sicknesses, colds,
Yeah.
flu,
Yeah.
things like that.
Yeah. Oh, that's nice.
Yeah,
That's so convenient, actually.
it is. Yes.
So your services remind me of concierge medicine a bit,
Mhm.
but maybe for the masses, if you will. So I'm kind of sure that the listeners are wondering about how these services will be paid for. You mentioned on your website that you accept most medical insurance plans, but are there other costs? Because you've mentioned the members being a member. So do you have like subscription costs or plan costs?
So we're usually, when we enter a market, so answer the question, Sam. Yes, we do have membership fees. The fees are minimal. They are nowhere near what you'd pay for concierge medicine.
Yeah.
And as you said, we bill insurance. It's no different than if I was to walk into any other brick and mortar office and hand them my insurance card. I'm going to pay the same deductible, the same copay, whatever it would be that I would routinely pay for services is what I would pay with the send.
Okay.
If the membership is an added value. So if you decide that you want to opt into the membership, you don't have the van fees. To deploy a van without a membership is $59.
Okay.
You can have a membership for under $25 a month for a single
Yeah.
person, which allows them unlimited access to van visits. During COVID, this was extremely beneficial
Yeah. Yeah.
as patients were, having COVID tests
Yeah.
3, 4, 5 times. But those, and then 24/7 access to the care team. So it's not a nurse line. It's not somebody who's going to triage your call. You actually call in, you leave a voicemail. If it's over after hours, the doctor returns your call within 30 minutes, maximum 1 hour is our
Yeah.
commitment to our patients. And then we'll triage you to a telemed visit if you need to be seen immediately. If it's just questions, they'll answer questions, but those are all the membership values.
Yeah. Very good. So, if I'm not a member, and I
Mhm.
happen to see your website and realize that you do telehealth visits, can can anybody just call and get a visit scheduled? Is that something that you do, or do you require that they actually sign up with one of your providers?
No, they can actually call in and get an immediate visit. We do, always recommend the membership, obviously, because it gives them so
Yeah.
much more access.
Yeah.
And it, cuts that $59 fee out
Yeah.
for the van, which is always a convenience. We do routinely run, specials, like if you call in and you establish care and
Yeah.
as a primary care provider, you get a free membership for a year.
Yeah.
There's things like that that we'll do to just allow people to try this type of healthcare. Um, as a user, I was
Yeah.
reluctant, and in building this, I was like, ugh, this is a very different concept. They used to
Yeah. It
do
is.
it. back in the day, but having somebody like come into my home, it threw me for a minute. And then I now every doctor I call, I had to have a colonoscopy done, and they wanted me to come into the office to do
Yeah.
my pre-op. And I
Yeah.
said, you don't have a telemedicine visit for
Yeah.
that? And
Yeah.
she goes, well, you can't get in for 2 weeks. I'm like,
Oh
okay,
my goodness.
something is wrong here.
Yeah.
That should be the easiest access. And it's literally a 15-minute pre-op call
Yeah.
that, the doctor, you don't really have to, to me, it's mind-boggling that more people haven't gone down this path.
Yeah.
It's not easy, because there is a lot of digital, integration and all the things that you need to do to make sure that you're able to successfully deliver it
Yeah.
and just to be accessible all the time without many complications for the user
Yeah.
or the patient. But I still am. I'm happy in ways that COVID pushed us.
Yeah.
I think that more people should really, or more providers should look at adopting if they haven't already, adopting some sort of digital platform for delivering care, because I do think it is where healthcare is going.
Yeah, I do too. I've been in the digital health space for many, many years. So it's always interesting to me how I think it first started with the EHR systems going electronic, right? That's the E in EHR. But then now with COVID and a lot of the bigger organizations going to telehealth and now offering that as a side-on service, I just see how that offering that kind of service helps to like prevent sickness in the long run in terms of all of these infectious diseases and everything. Even if we just forget COVID for a while, even though that's what pushed it, cold and flu season, right?
Right.
How many additional lives could we potentially save by not having cold and flu infection just run rampant in doctors' offices?
Well, yeah, and I mean, let's think about it for a minute. You're actually encouraging people to go and sit in a waiting room
Yeah,
with multiples who are sick. Not just that, but in this type of model, with a primary care also trying to bridge a gap where urgent care and emergency rooms have been for so long abused and
yeah,
overused.
yeah,
Um, and understanding that, to really fully take care of your patient, you should know when they're having those sick episodes, what type of meds they're being put on. And many times there is no communication back and forth between that urgent
mm,
care and that primary care provider. And so that patient, it's a disservice to that patient in many ways
yeah,
because they don't have their provider who is taking care of them holistically doesn't have the big picture.
yeah,
They don't know everything about them. And
yeah,
I think if we truly are looking to change outcomes and make them true quality outcomes for patients, for you and I,
yeah,
um, it needs to be a very holistic approach, taking care of as much as you possibly can. And then when you do have to rely on specialties or urgent cares, that there is a true connection between those groups that take care of that patient. It's not just taking care of being able to run day to day. It's
yeah,
really investing in the patients and making sure their outcomes are top priority.
yeah, yeah. That's so true. So I'm just curious to know of your four services, which are primary care, pediatric care, urgent care, and mental health care, which one is being utilized more than others by your patients? And if you have an understanding about why that might be.
So we've seen a huge uptick in primary care and behavioral health.
Yeah,
Those are our two biggest platforms right now. Behavioral health has increased, I believe the last numbers that I looked at, by 60% over the last 6 months. Um, There's such a need. I think COVID has, thrown so many people into a mind frenzy. We spent so much time alone, or just with a few close people, and then you're, especially kids right now, are just struggling. 2 to 3 years of their lives were disrupted and changed. So I think there's a lot of need for people to just talk to someone, for that, to give them some guidance and to lean on to help them through these times. So we've seen that really grow. We've actually added, a year ago, we had one behavioral health provider. We're now up to 7.
Oh, very good.
Across the 2 markets. And they range in every specialty, ADHD, children's, family, and marriage counseling. It really is a vast offering that we provide for our patients. And then on the primary care side, I really think most of our referrals have come in from people who have used the service. So once people have that initial visit in their home, their reaction is, I'm not going back. I'm never going back to having to go to an office. And so then they say, I'm telling everybody about this. We've had people buy their families memberships for a Christmas gift.
Nice.
So it really is, I think, experiencing it one time, so that you understand what the offering is. And then it's, you just are bought into, it's hard to go back. If you're going to come to my office or my home, or meet me in the parking lot of the airport. So I was sick and I was getting ready to travel to Atlanta, and it was a different sick. And I thought, you know what, I'm a little worried to get on a plane and expose everybody else to this. And I don't know what it is. So the care team met me in the parking lot of the airport 2 hours before my flight. And I took a COVID test and it was positive. And she said, she looked at me, she goes, get back in your car, go home and take care of yourself. And I was like, think that's convenience. I mean, that's unheard of in this world. And we do that. We were doing that all the time. We would meet, airline flight attendants and pilots at the airport when they would come home from trips because they didn't want to take it into families. We would meet them before trips. So it really is, it becomes a convenience factor added on to it. It's just a real different way of providing healthcare where you feel involved in your journey with the provider.
And truly meeting them where they are, regardless of whether that's at home or not. Very good.
Right.
So this is a great time to talk about where you're actually functioning. So you're in Atlanta and the Austin metro areas. Do you have plans to expand to other markets, other cities? And what does it take to really offer your services in another location?
So yes, we have, I mean, like everybody, we have goals and aspirations to be in every state. We, at this time, we're really looking for those health care partners, health system partners, IPAs, groups that welcome us in and see the value in the offering. So I think, just to give an insight, in 2024, our plan is early spring to be in all of the Texas markets, and expanding service out to rural areas where we can, because we know that there is access to care needs there. And being able to help systems deliver that care with this type of offering is where we see a lot of value. So that will be mid to early 2024. And then the next market is we're looking at a couple different markets where we see that there is a high, a higher, I don't, what's the best way to say this? Where getting into a primary care provider takes anywhere from 3 to 6 months that
Oh, right.
patients are waiting. Where the
I think
need is,
where there's a high patient to provider ratio.
yes, and or, just in getting into the market, the understanding is, hey, I can't even get into my primary care provider for three to
Right.
six months. We know that then it's an offering and an area that we can help bridge that gap,
Yeah.
to drive down, emergency room visits, urgent care visits that could otherwise be seen, by a primary care provider.
Yeah. Yeah. Very good. All right. So finally, I think you talked about really what's next for Ascend Medical, but is there anything else that you would like to discuss before we end the podcast?
Um, no, I thank you first of all for asking and inviting me to do this. We've been really working hard to get the word out about,
Yeah.
um, what we do and how we do it much differently than others, and then really encourage, the people who are working on the technical side of healthcare,
Yeah.
and wanting to be disruptive and
Yeah.
change how people look at healthcare, to keep pushing that envelope, be those entrepreneurs, keep looking for different ways, because there are groups out there who really want to engage and change healthcare quicker than what it has in the
Yeah.
past. It's taken so long for us to get to this point. I would hate to see us just hang out in this little space for a long time, without really advancing and using technology to help us do that.
Yeah. Yeah. I also agree with you. I think we need to keep the momentum that COVID has provided us with, going more digital with healthcare, to, as you mentioned, to provide better outcomes for the patients. And it was my pleasure to have you today. And thank you so much for taking time to talk with me, Samantha. I really enjoyed learning about Ascend Medical and what you're really doing there to deliver care and seeing the patients where they are. I mean, literally where they are, as we talked about today. And then let me just put this up. So if you would like to have any other information about Ascend Medical or Disrupt HealthTech, please look at the links below. And I want to thank everyone for attending the podcast today, and we'll see you next episode.
Thank you so much. Bye-bye.
Thanks for tuning in to Disrupt HealthTech. We hope you found our conversation today inspiring and informative. Remember, the key to success is using technology in an innovative way to improve healthcare experiences and patient outcomes. So keep a lookout for ways to challenge the status quo and keep innovating. See you next episode.